Hey everybody, welcome to this clinical insight. We're trying something a little bit new here with going through kind of a PowerPoint presentation, but still providing you some more information on this. So if this is something that you are listening to via the podcast, through a podcast app, which we'll obviously have available. If you wanted to see the visuals for this one, there's a couple slides. I'll do my best to make sure to explain it all so you get the general idea. But go to clinicallypress.com and look up the clinical insight there, or check it out on YouTube under the clinical insights. This one is on the hamstrings, and this is a tight versus taut discussion where a lot of times hamstrings get blamed for everything. Low back pain, it's tight hamstrings, you got to stretch them. My knees hurt, hamstrings tight, stretch them. While that is very potentially the case, it might not always be their fault. And that's what we're going to talk about today and just kind of take a look at why that might not be true. So the first slide really is just saying how the hamstring gets blamed for everything. And with that, I think that it's fairly misstated. We tend to be very forward moving in society. Obviously, it's how we walk, that's how we do a bunch of things. But then we get super tight through our anterior chain and our posterior chain, our hamstrings, our glutes, our calves, while the extensors of our back get the brunt of that stress. When you sit, think about how much tighter that can make your hip flexors because you've effectively turned off your glutes and your hamstrings and everything with that. And so a lot of times that will lead to just a general anterior pelvic tilt. And that's what we're showing in this picture here, where the hips and the pelvis actually rotate forward, which then changes the whole biomechanics of your body. If you're able to see the pictures, you look from the left, which is a more neutral pelvis, to the right, where it's more of an anterior tilt. This curve in the spine becomes more pronounced all the way up. You can see it in both the lumbar and the thoracic. Everything else starts rotating, moving forward. And what we're trying to show here is when your pelvis anteriorly tilts, the insertion point of the hamstring has to go with it. So your hamstring is attached just below the knee, but also come up and attach to your ischiotuberosity on your pelvis. So if you've got this rotation and that insertion at the ischiotuberosity goes up, your hamstrings are going to get put on a line of stretch already. So with that, they're already going to be put on some level of stretch. And this is where I think a lot of it gets confusing, in that your hamstrings aren't actually that tight and causing your low back pain, especially if you've got a more pronounced curve in your lumbar spine. Your hamstrings aren't doing that. Now, on the opposite side, if you were to have a posterior tilt and you were losing curvature in your spine because your hamstrings were pulling your pelvis back so far, and that was reducing that curve in your spine, then you might be able to blame your hamstrings for that. With this, I think, again, due to our sitting, due to a lot of our training in sports and different things, our hip flexors really end up being the problem. This can a lot of the times be the case from the psoas and the iliopsoas complex, in that it attaches at your femur, kind of wraps around your pelvis, and then goes up and attaches to your lumbar spine. So if you can imagine that, and how if that's shortening, it's going to pull you into this anterior tilt and then put those stretch on your hamstrings. One kind of fun trick I've seen Kelly Starrett do is sit down, grab just like as much kind of skin and tissue as you can in your hip flexors, and then try and stand up and stand tall. And obviously you're not going to want to because you're grabbing onto that skin. But that kind of represents what is happening when that whole complex gets short and tight from sitting all day and all the other activities that we do in that regard. So one thing we want to talk about is a test for true hamstrings and if they're tight. And this is one I learned. I can't remember where I picked it up, but if you lay down on your back and you were just to go stretch somebody's hamstrings, a lot of times their pelvis is already in an anterior tilt. They're not in neutral. So if you bring their thigh up to 90 degrees and then try and extend their lower leg. Not very many people can get that go to perfectly straight. That's pretty impressive if they're able to do that. But if you have them contract their glutes before you move their thigh up and extend their leg, so this ineffectively resets the pelvis, puts it more neutral, takes a little bit of extra curve out of your spine when you're laying on the ground, you should see a pretty good increase. And that's where you're going to start being able to see if their hamstrings are really that tight. Most people, again, aren't going to be able to go straight up and down, but if you're within 15, 20, potentially 30 degrees, you're doing pretty good. And odds are it's not your hamstring that's really being the cause of your problems. And you might want to start taking a look at other factors. One that we generally give a guideline to the athletes I work with is for every time you stretch your hamstrings, you need to stretch your hip flexors 2 times to kind of make up for that, because we are so anteriorly dominant in everything that we do and just the way that we get through life. That's a very big one. Kind of the same thing with foam rolling. Spend a little extra time working through that anterior hip flexor mass, trying to get that thing to loosen up. Can help relieve your back pain, can take that tension off your hamstrings, and then also just making sure your quads are loose too. But that should be a huge area of focus. So bottom line with this one, while your hamstrings very well could play a role in low back pain and other problems, don't blame them for everything. It's too complex and everything meshes together way too much for it to just be one true thing. So that's where we would suggest taking a look on the opposite side and all that anterior musculature to try and get that loosened up and really try and get things moving there. And we think that should have a huge benefit for you. And also help you feel a lot better. So as always, if there's any questions, please leave a comment, reach out to us. We're happy to talk about this stuff where you find it fascinating and just want to share with everybody. So with that, thank you for listening to this clinical insight and have a great day.